Alright folks, so now we're going to talk about directional terms in anatomy. And students sometimes struggle with this, so you need to think opposites. So each one of these is opposite to the other one. So when you're thinking about this right here, you need to look at where the arrow is at. So if you look at number one is cranial or superior. So number one is right here. So superior above or cranial toward the head, and inferior is below. And caudal means toward, it's below or toward the tail region. So if you look there, number one is near the head and it's pointing upward. And then if you look down here, number two is pointing downward. So number one is either cranial or superior, and number two is caudal or inferior, which is down there pointing away. So those are opposite one another. Superior is above, inferior is below. If you look at number 3 and number 4, they're also opposite. So if you look on here, you have to find number 3. Number 3 is pointing toward the front. So number 3 is right here. So that is the front side of this 3-year-old's body. So that's ventral or anterior, versus the back side of the body, which is dorsal or posterior. Once again, opposites. And then if you move down here, normally this is how they show this. If you're thinking closer to the point of origin, that's proximal up here. And distal is pointing away, is what you can think about to get this right. And so distal's in the distance and proximal is closer to the midline. So this is closer to the midline of the body and this is further away. So this is medial, right in here. This is medial going down the center. And so this center line. And then so this is proximal and this is distal. So proximal is going to be closer to the center line and distal is going to be further away. So if you look up here, you have number 5, which is proximal, and number 6, which is distal. And then we have 2 more, and it's medial versus lateral. So medial, you need to think medial middle. So medial is toward the midline, right down the center of the body, and lateral is out to the side, so over here. So like in football, if you throw a lateral, you're going to throw it across to the side, either straight across to someone or possibly behind. So those are your directional terms, and if you just think opposite, that'll help you to get those right.